From WDRB, Fox in the Morning starts now.
Good morning to you. It is the 3rd of September, a day we'll always remember. And this is Fox in the Morning. I'm Barry G. Burnson.
And I'm Candace Clift. Carpal tunnel syndrome can make very simple tasks quite difficult by causing numbness and muscle weakness in the hand and wrist.
You've had it too, have you not? Yeah. Louisville's leading hand surgeon, Dr. Joseph Kutz, is here to show us how to lessen the symptoms and even prevent it from happening, carpal tunnel syndrome.
Over the last 10 years or so, we've seen a lot of developments to keyboards, mouse pads to help prevent carpal tunnel syndrome. But using your keyboard is actually not the main cause of it. This morning, world-renowned hand surgeon Dr. Joseph Kutz is here to explain what does cause carpal tunnel syndrome, who's at risk, and then what we can do about it. Good to see you.
Good to see you.
I have to point out your tie with hands on it. I like that very much.
Thank you. Thank you.
What is the biggest cause of carpal tunnel syndrome?
Well, I've been in medicine about 50 years, and the first thing they told me when I was in medical school, the primary cause of carpal tunnel is pregnancy. Secondary cause is rheumatoid arthritis. Third cause is diabetes. And the fourth cause is other diseases of the synovium.
So that tells us then that some of us are just already at risk for developing this.
That's correct.
What can we do about it? And first of all, how do people notice whether they're developing some type of issue with carpal tunnel syndrome?
They usually start noticing, most of the time, it's night discomfort. When they're sleeping, their hand is flexed. Most of us kind of close our hand up and flex, and they wake up tingling, and they wake up and then they start shaking their hands and working it out. That's why they started developing the braces that you sleep at night to keep your hand from bending it down. To be able to prevent it is a matter of preventing fluid retention, because it's most of the fluid retention. It's a fluid. This is the synovium, which is the lining inside of your carpal tunnel. This is your carpal tunnel, and this tissue here is the lubricating mechanism of all your tendons. And that's what fills up, and that's what actually produces the pressure on the nerve.
Which would explain why pregnant women have issues with this.
Right.
There's a lot of swelling. I had this when I was pregnant. I had issues with it. And you notice this numbness, and all of a sudden you can't do something simple like open a car door because your hand goes numb.
Your hand goes numb, or it feels like that you've lost your function.
In addition to those braces that you can wear at night, what are some other prevention steps that we can take?
Well, basically, as I said, is reduce your carbohydrates. It reduces the fluid retention that you have, and so it doesn't stimulate the pancreas, which produces out more fluid retention. So reduce your carbohydrates is a good idea. That's why you get it in diabetes and this type of thing. You can do stretching exercises where you actually stretch your hand out, rotate your hand over. You can rotate your hand basically this way and stretch it. But wearing the braces at night probably gives you the most attempt. And it's a question of being examined early enough, because many times you can be examined and you can treat this by injections of steroids in the carpal tunnel itself. We
only have a couple seconds left, but at what point should somebody call you and come and be examined? What symptoms should trigger them to come in?
The increased bout of night pain and waking up at night. And the other thing is when they start increasing pain when they're actually typing, and that has to do, similar to carpal tunnel, but it has to do with another condition very similar, with the pressure on the nerve.
Okay, Dr. Kutz, thank you very much for coming in to explain this. It mystifies a lot of people, but you can take steps to either lessen it or maybe prevent it. Thank you very much.
You're welcome. Thank you.